Hello, I'm Victor Yalom, and I'm pleased to be here today with Cathy Cole. She's been training professionals in motivational interviewing for over 15 years, and we're fortunate to have her as our guide into the theory and practice of motivational interviewing, both in this video on the core concepts and throughout this series, Motivational Interviewing Step by Step. Welcome, Cathy.
Thank you, Victor.
So I think many of our viewers have heard the term motivational interviewing, but many of them also don't know exactly what it is. So I think that's a good place to start. What exactly is motivational interviewing?
Okay. Well, I'd like to talk about motivational interviewing first. We always call it a counseling approach. But more specifically, I like to talk about it as a conversational method. And that particular conversational method is designed to allow people who are struggling with the possibility of making change. It's designed to let them consider their own reasons for making change and to make their own unique decisions about change and decide how they might go about it. So motivational interviewing is a way to help people guide their way through this matrix of change.
And we know that helping people to change, it's not easy.
That's right. It's not easy. Exactly.
What's hard about it?
Well, from a counselor's approach, one of the challenges, and particularly the challenge that we think about in motivational interviewing, is we hear a person talk about their struggles about making change. Let's say we hear a person struggling with whether or not they can maintain a regular exercise program. And we immediately, as professionals, start to have ideas about what we think they should do, and we move into telling them what to do, which in motivational interviewing is called the writing reflex. So we really...
What does that mean, the writing reflex?
The writing reflex. The writing reflex is the natural inclination that all of us who are in the helping professions have to want to make it better for another person. And so when we get caught in the writing reflex, we assume that we know what's best for another person and we go about telling them what to do. And this immediately bypasses the person being able to explore that for themselves and decide what might work for them. So that to me is one of the biggest challenges about helping people, is basically getting out of the way.
And when we tell them what to do, how do they tend to respond?
There is this natural inclination that most of us as humans have when someone tells us what we should do, even if it's something that we have already thought that we would do, that we argue against it.
Really?
We push away. It just seems to be this natural inclination we have as humans to do that. So right there, we're creating an obstacle, a barrier for folks that really is not necessary for them.
So later in this video, we're going to get into kind of the nitty-gritty, into the details, the techniques, but just on a broad brush level, what is the approach of motivational interviewing, and kind of what's the guiding philosophy, or I've heard it referred to as the spirit?
Right. The spirit to me is actually the most important part of motivational interviewing. How we go about it are the details that we'll talk about later. But in spirit, we really are paying attention to working in partnership with the client. We're there as best we can to not be in this hierarchical relationship with them, but we're there to partner, to say, I'm in this with you, and I want to help guide you through this forest of your decision about making a change. So we work in partnership with them. So we're really collaborating to learn from them what are their ideas about why they might make a change, how they might go about it, are they able to go about it. So we really want to guide them through it. And we are definitely working to reinforce that the client is always the one in charge, that they are the ones that are going to make the final decision about whether they will make change, how they'll go about it. So we're reinforcing client autonomy all the way through.
And I understand one of the roots of MI, or as motivational interviewing is referred, is Rogerian, person-centered.
Absolutely. It's a client-centered way of working with people. And by client-centered, we mean that the client is the important person in the room, that I'm there to help navigate the course with them. I'm there to help keep them on course, to be a guide. But the client-centered part means that we are focused on exactly what it is that they're thinking, what they're believing, what it is they want to do.
And whether they're coming in voluntarily or mandated, it's ultimately their decision.
It's ultimately their decision.
So one of the things I know is that it's been used widely. It started in addictions, but it's spread to healthcare, criminal justice system. Where else is it used?
You're right. It is used very, very broadly now. It's really used in almost every aspect of healthcare now, so that it's used in situations of chronic disease management where people are talking with clients, patients, about their ability and their desire to manage their health behaviors around things like diabetes and hypertension, weight management, those kinds of things. It's used with parents who are being encouraged to take a look at the weight issues for their children around the childhood obesity kinds of things. It's used with teens to help them address issues like their smoking, their own weight issues, their use of drugs. It's used broadly. I can't really think of really any area now that motivational interviewing is not being applied.